This is Dr. Corey Maas on Looking Your Best. I had a patient that came in today that asked a great question, a question that I'm frequently asked about surgeries in general, but specifically today about rhinoplasty. And this patient is ready for a rhinoplasty. We've had a previous consultation, and she wanted to know, and found out just recently, that she is going to be getting married. And her question was, how much time does she need to have if she's going to have the rhinoplasty now before their wedding date? Does she need to be fully ready to have any of the effects of the rhinoplasty recovery gone and really be looking her best? And in general, I'd say the answer is twofold, because there's no absolute guarantees. But in most cases, I tell people that rhinoplasty is about a three-stage process. The first stage of recovery of rhinoplasty, the acute stage, is where people have swelling around the eyes and nose. There's typically some degree of shiner or black eye underneath. And that phase, that first part of recovery phase, is difficult to do anything really socially. You're not going to parties, etc. But it's a time where you have to recover, time where you can actually do some non-stressful exercise like walking or even a stationary bicycle in some cases, but you're not going to be doing a lot of social events. The second stage is that after 2 weeks, and that 2 weeks goes out to about 2 months after the surgery, 2 to 8 weeks then. And in that phase, while we take the cast off and the splints and we clean the nose, and for the most part people have complete resolution of swelling, of the acute phase of swelling that's noticeable and bruising, there is still a small amount of swelling and recovery that the patient, that you might notice during that period. That diminishes rather quickly over the first couple months. So at the end of 2 months, your nose actually looks and feels pretty good for most people, and is certainly not noticeable as having had a rhinoplasty in 99% of patients. I would never tell someone that's getting married to plan on that, so if they had enough time, I would tell them in the 6-month range, 6 to 12 months range, is where we're certain that they'll be comfortable, happy, that the shape of the nose will be near its completed healing phase and have the shape and form that we are looking for after rhinoplasty. So the basic minimum, I would say, in scheduling an enormous event where photographs are going to be taken that last for the rest of your life would be about a 6-month period if the time clock isn't critical, and that could go out to 12 months where you really see the final results with rhinoplasty. And this is particularly true with revision rhinoplasty, where about half of the surgeries I do are revision rhinoplasties. There's even a little bit more of a lag or delay time in the recovery period if there was a previous rhinoplasty or significant nasal trauma that had occurred at some point in the patient's past. So the summary is that when asking about recovery from this specific procedure, rhinoplasty, I think you're socially acceptable within 2 weeks, and certainly that 2 week to 2 month period is fine. I wouldn't schedule any big events around that time of the procedure and recovery. In the area from 2 months to 6 months, you're sort of in the 50-50 land, and I would say as you get out closer to 6 months, you're going to be pretty certain that you're going to really look your best and be totally fine to schedule any big or small event that's important in your life. So you could comfortably do that anytime after 6 months. And that's where I really recommend big event scheduling, things where you're going to have photographs that last for the rest of your life, even with different types of photoshopping and changing pictures. You'd really like to look the very best you can in those images. A 6-month time window after rhinoplasty is a good window to pick. That's a great question on general recovery. 3 phases of acute recovery from rhinoplasty. That's the acute, latent, and the sort of chronic phases, and they're really great to plan around. I'm happy to answer questions about rhinoplasty or any of the other facial, plastic, or aesthetic services we provide here at the Maas Clinic. If you want to visit us at drmaas.com, you can write those questions in, send me photographs or videos. I'm happy to do video teleconferences if you call in the office at 415-567-7000. And as always, I'm looking forward to hearing from you. This is Dr. Corey Maas on Looking Your Best.